Again, we are honored to have Dr. Thomas Kottke, Medical Director for Well-Being at Health Partners and Professor of Medicine at the University of Minnesota. He is also Services Researcher at the Health Partners Institute in Minneapolis. And Dr. Kottke obtained his MD degree from the University of Minnesota School of Medicine. He also trained in internal medicine at the Royal Victoria Hospital in Montreal. Hey, we got another fellow Canadian, too. And also North Carolina Memorial Hospital in Chapel Hill. And received an MSPH in epidemiology from the School of Public Health, University of North Carolina in Chapel Hill, where he was also a Robert Wood Johnson Clinical Scholar. And Dr. Kottke also trained in cardiovascular diseases and preventative cardiology at the University of Minnesota. Dr. Kottke is a board certified in internal medicine and also in the treatment of cardiovascular diseases. He'll probably tell you a little bit more about himself, but I do want to say it's kind of neat. He is a member of the first U.S. Preventative Service Task Force and 3 federal panels that authored evidence-based guidelines for the clinical treatment of tobacco dependency. So he's got a lot of qualifications behind him, and we're very honored to have you, Doctor. So
thank you.
Thank you.
So thanks a lot. And left out there is I was at Mayo Clinic from 1988 to 2004, and it's good to see my friend Tom Harmon and the mayor. So we've heard a lot about the how today, about lifestyle, but I'm going to talk about the why. And I think most of you probably know why you're practicing a plant-based lifestyle, health-promoting lifestyle. But we've got a problem in this country. About a year ago, I talked to my friends at the Minnesota Department of Health, and I asked them about rural suicide. I knew it was going up. I thought, well, maybe it's about guns, and we can use that as a reason for more gun safety. Well, the problem is it's not about guns. People are suffocating themselves. And if there's any docs in the crowd who read JAMA and saw Steve Wolf's paper about 2 weeks ago about the rising mortality rates in our adolescents, about 2008, our suicide rates in adolescents started going up. And so like Jimmy Carter said back in 1980 or whatever, we have a national malaise, and it's quite severe. And so what I was going to do today is talk to you about the why, because I think to invest in healthy lifestyle, which is really swimming against the stream of the American environment, the why you need before the how. Okay. So a conflict of interest, no financial conflicts of interest, and I won't be advocating commercial products or advocating off-label use of medication. What I'd like to do today is describe the 6 actions that can be taken. You've already talked about this. The difference between hedonic and eudemonic happiness, why mental health is not simply the absence of mental illness, and 5 components that promote flourishing as described by Martin Seligman. So we've seen all this. Adequate physical activity, not using tobacco, fruits and vegetables each day, and as close to what I tell my patients is as close to a vegan diet as you can tolerate. Alcohol only in moderation if you drink at all. Recent studies showing that there is no it was thought for a while that there was a little bit of alcohol was salutary. It's not. Healthy sleep, which is a huge problem for many and then healthy thinking, which is also a huge problem. And I'm going to focus fairly much on healthy thinking. So you heard about the North Karelia Project last presentation. It was organized in 1972. Very simple. More fruits and vegetables, less saturated fat, tobacco-free, and hypertension control. And actually, most of the animal product there was milk. It was not meat. I first wandered into North Korea in 19. Have been working with them since that time. And one of the things, this is those in the crowd that says no smoking. We participate. We participate, and that was part of the message. There was
even if you had a perfect health profile, what you could do is, if you had a party, you could serve a healthy diet, those kind of things. You could. I met a young Finnish woman. This was probably 25, 30 years ago, here in Minneapolis, and she said, I was here for 3 months before somebody invited me to go out and do something other than eat. So you can say, hey, let's go for donuts, let's go for a walk, those kind of things. But the message was, this is a community-based, this is an environmentally based epidemic. Okay, and what you also heard in the last talk was that life expectancy increased by about 10 years for men and women between 1972 and 1971 and 2007. And so this was very different than what I was taught in grad school. I had a professor stand up in front of a class about this size, and he said the only way to increase life expectancy in a community is to decrease mortality rates in infants and young children. Wrong. Okay, so I'm going to go back to the psychology of well-being, and we traditionally only ask, how far underwater are you? Okay, how bad do you feel? We don't talk about, do you feel good? And we ask, do you have little interest in doing things, trouble falling asleep, poor appetite, trouble concentrating, thoughts you'd be better off dead? Are you feeling down, depressed, feeling tired, etc., etc.? This is the PHQ-9. This is, we don't ask people, do you feel good? We would benefit from a broader focus, and this is Corey Keyes. He was president of the American Psychological Association in the past. The current national strategy of focusing solely on mental illness can at best reduce mental illness, but not produce mental health. Okay, mental health and mental illness are different things. Whoops. Put simply, the absence of mental illness is not the presence of mental health. Flourishing individuals function markedly better than all others, but barely 1/5 of the U.S. adult is flourishing. Okay, so what is flourishing? It's hedonic well-being, positive functioning. Languishing is feeling bad, not joyful, and lack of positive functioning. So what do we mean about that? Well, hedonic well-being, positive affect, regular cheerful, interest in life, in good spirits, happy, calm, peaceful, full of life, and satisfied with life. Positive psychological functioning, self-acceptance, you feel good about yourself, you have a purpose, we think of Viktor Frankl. Environmental mastery, you feel in control of your environment, autonomy, and positive relations with others. Positive social functioning, acceptance, a positive attitude toward human differences. Actualization believes people, groups, and society have potential to grow positively. Contribution sees own daily activities as useful to society and others. Coherence, interested in society, and integration, a sense of belonging. So, to flourish or not positive mental health and all-cause mortality. So this is Corey Keyes again from about 10 years ago. Midlife in the United States study, the MIDAS study, baseline in 1995, 10-year follow-up, 6.3% died. In the fully adjusted model, risk of death for non-flourishing versus flourishing was 1.62. So this was about the same as for major depression. But major depression is maybe 10% of the population. Not flourishing is about 80% of population. So it's this group that just, raise your hand if when you ask somebody how's it going, they say, oh, not so bad, or could be worse, or just this habitual down in the mouthism of choice of Minnesotans. So Martin Seligman. So Martin Seligman, he's an interesting guy. He's the father of positive psychology, and so he before he was president of the American Psychological Association, he was basically a dog shocker, and what his studies were, he if you put a dog in a box that has a partition down the middle, if you shock the dog, most of them will jump out and get away, but a bunch of them will cower, freeze, and he said, no, I do not want my legacy to be known as that of a dog shocker. And so he basically developed positive psychology and said about flourishing. And if you want to read a book, I'd get this out of the library. And he said, flourishing is positive emotion. You feel good. You're engaged. You have relationships that are positive relationships. I'm going to get into this a little more because we've got another epidemic in this country, and it's an epidemic of loneliness. And then meaning and purpose, you think of Viktor Frankl, and then accomplishment. And he threw this one in. He's an average bridge player, and a bunch of his buddies, they live life just to beat the other guy in bridge, but they enjoy life. And so he had 24 character strengths. I'm not going to read them all, but creative, perspective, judgment, etc., etc. And the weakest strengths that correlated with well-being are prudence, judgment, and self-regulation. But the strongest are hope, gratitude, and love. And you can see that. That makes sense. You're hopeful about the future. You're grateful. And we're going to get into this a little more. And then love, and it's really gratitude and love of learning. You're curious about the future. You want to learn. You learn from people. You learn from books. You learn. Okay. Does this really work? This was, in fact, this is getting old. This is about a little over 15 years ago. Internet-based randomized controlled trials. So these are people who probably, they're a little down, they're looking around on the internet, how can I feel better? And so it was placebo-controlled exercise of early memories, a gratitude visit, 3 good things in life, you at your best, identifying signature strengths, or using those signature strengths in a new way. So there were 6 different interventions. And this is depression, and the checks, all right, post-test, does this thing have a pointer? Whoop, did I just turn it off? No, I didn't. Good. Post-test, 1 week, 1 month, 3 months, 6 months. And early memories didn't do any, people didn't feel better at all. A gratitude visit. So you went and visited somebody and you thanked them for something they had done. That worked for about a month. 3 good things. And this is simply sometime during the day. And some people do it in the morning. I have a friend who wakes up every morning. She's religious. And she thanks God for having a dry bed. A warm, dry bed, which I came back from Atlanta last night, and I park out at Health Partners, and so I ride the light rail. I can tell you, there were a lot of people on the light rail who did not have a warm, dry bed. You at your best, ID strengths, and using strengths in a positive way. Okay, so 3 good things, and it's simply every day, 3 good things that happened to you, and why. Writing them down. And all they had to do is write this down for a week. They didn't have to do it, but it's something that can be very, very easy, and it's, So my undergrad is in anthropology, cultural anthropology, and I would say that one thing that's things vary a lot around the world, like images of who or what God is, good food, good music, and good use of recreational time. But what doesn't vary is the presence of prayers of thanksgiving. Okay, and that may be something that's gone from our lives. I myself am not religious, but prayers are, genuine prayers of thanksgiving or simply observations of thanksgiving make a real difference. My life is good. Why is my life good? Well, I'm healthy. I love to ride a bike. I have 7 bikes. I have a wife. I have a family. I'm able to come down here, etc. So this is happiness and positive psychology interventions. And what we see is that simply thinking about 3 good things every day and writing them down, why, lasts for at least 6 months, and then using strengths in a positive way, this pro-social behaviors. So it's easy to improve your own well-being. Thank people who help you, even for the smallest task. And I sort of have this perception that the politics have turned negative, in the last 6-8 years, and that we're losing thankfulness. Be kind to people if you ever have the opportunity. Just simply kindness. And then at the end of every day, note 3 good things that have happened and why. Okay? And this, once life is valued, and we think, and we're working on these studies, we think that once you have a life that you believe is worth investing in, you will invest in it. If you think your life is just garbage, why would you invest? So, we can also improve the well-being of others. And world hunger, world peace, those are the war in Ukraine, the war in Sudan, those are tough for us here in Rochester to deal with. But what we do know is that we can improve. It's very easy for us to improve the lives of people immediately in our social network. And this is from the Framingham Heart Study. 4,739 individuals followed for 20 years, and happiness measured with validated 4-item scale. And what we see is the spread of happiness. The smiles are the yellow, and the frowns are the purple. But happiness spreads. You can spread happiness by being kind to people, being nice to people, being helpful to people, thanking them. And the nice thing is it comes around back to you. Okay? That being with happy people makes you happy. This is another study. This is assigning people to relationship-focused gratitude or individual focused. They were also kindness, assigned to kindness or self-focused groups. And those in the control condition were asked to list 3 things that occurred over the day and reflect on how they felt. All participants, regardless of condition, were instructed to complete their assigned activities every second day over 7 days. And what we see is that this is overall relationship satisfaction, that relationship-focused increased, self-focused increased, and then decreased, and controlled decreased. And so your relationships are better when you're nice to the people you relate to, you thank them, you help them. And I think about when I was in training. So I was in cardiovascular training from 1978 to 1981. And right about that time, there was this movement afoot that said, if you're a volunteer, you're just a rube. Don't do anything that you don't get paid for. And I think that was a major negative. It was a major negative because we understand now the positive aspects of volunteerism. Social networks host resistance and mortality. This, by Berkman and Syme, this is a very old paper, 1979, and it really, I'm going to say, it really pissed off the traditional epidemiologists, because what you see here, the findings show that people who lacked social and community ties were more likely to die in the follow-up period than those with more extensive contrast. The age-adjusted relative risk for those most isolated compared to those with most social contacts were 2.3 for men and 2.8 for women. Then it goes on. These were stronger than cholesterol, stronger than smoking, stronger than anything else. And the epidemiologists said, well, what is this? This isn't a disease. It can't be. It isn't a disease. But our functional MRI shows that, in fact, it is a disease. We are social animals. We are social animals. We have things called mirror neurons that all of you are thinking, hey, what's it like to be up there giving this talk, you know? That's what your brain is thinking. And I'm thinking, you know, what's it like to be sitting in the audience listening to me? But this is, social isolation. And you've probably heard that being socially isolated is hazardous to your health is smoking half a pack of cigarettes a day or something like that. And this is levels of social integration and mortality in 5 prospective studies. So it's not Alameda County alone. And you can see, and this is females, and that's males. Everyone, as they get high social isolation, high integration, levels of risk go down. So like what John Prine in his song said, you know that old trees just go stronger, old rivers grow wild every day, old people just grow lonesome, waiting for somebody to say hello in there. And my wife and I, we have 3 Norwich Terriers. They're these little terrorist dogs that love to come over and lick you and after they bark at you. And we walk around and we were, my wife was talking to a guy who moved in. He lives alone, but he said, you know, you're the only people that stop and say hi to me. He says, I try to make contact with people, and they just walk by, or they, you know, say hello in there. I would highly recommend this book. This is Matthew Lieberman. He's a respected brain investigator, but this is a trade book. He says, so even strangers we don't want to interact with activate the brain's reward system when they tell us they like us. The aspects of sociality are becoming just so clear with functional MRI that being around people, and this is why solitary confinement is so cruel, is that it isolates people from other people. So am I asking you to abandon your aspirations? No. You can still practice healthy thinking and still aspire to a goal of a better life, unless you are either a bank robber or a street thug. Healthy thinking is more likely to get to your dreams than being mean, morose, or dispirited. And particularly in a business like mine, I'm an associate medical director at Health Partners, and I have to have people want to work with me. And most of us have to have people want to work with them. And so being nice, being helpful. And I always told my residents, you know, if you want a job, you know, if you want to keep, you know, if you want a job at the Mayo Clinic, just make sure people will miss you when you're gone. You know, they'd say, oh, we can't let him go. He's so helpful, you know, and people like working with him and all those kind of things. And so it, and you know, it just helps. It's not wasted. It's not wasted coin to be nice to people and to helpful and kind. So, but won't promoting well-being just increase disparities? Well, most of us would benefit from improved mental health even though we're not mentally ill. Ignoring the needs of individuals who could benefit from better mental health does not help the mentally ill. And simple maneuvers can increase mental health and happiness in individuals creates happiness in groups. And so working with groups, there is an argument that with all the mental illness there's a lot, that we shouldn't be focusing on feeling better. But we go back to this languishing. These people who languish are not mentally ill. They're just not mentally healthy. And the impact in the population. And then once they feel flourishing, investing in other healthy behaviors like not smoking, like eating a healthy diet, etc. Very important, very effective. So a couple of final thoughts. We need to train our brains like we train our bodies. And we can train our brains. I mean, just deciding that when somebody says, how you doing today? And rather than saying, could be worse, not so bad, great, I'm doing well. I mean, I actually, this is a confession. I mean, about 6-7 years ago, I decided to do that. And it's really pretty amazing. You know, if ever, somebody asks, how are you doing? I'm doing very well. I'm doing great. You do great. You get to believe it. And those of us, if we have the choice of coming here and sitting with a group of like-minded people in a peaceful community, we're doing great. It doesn't matter what's going on, else is going on, we're doing great. Okay. And the only cost of cheerfulness is the loss of your grumpiness. Right? I mean, geez. Okay. Oh, and then there's a native son. I was supposed to talk about this is the home of preventive cardiology, Minnesota. Well, Dan Buettner, he's a University of St. Thomas graduate. And, of course, the blue zones. And, you folks can make your own blue zone here. And it's, movement, a natural part of your day, knowing your sense of purpose, prioritizing stress relief, eating until you're only about 80% full, et cetera, et cetera. Now I have to tell you a little story about Dan. He's done a whole bunch of stuff. Like he rode from the Arctic Circle down to the tip of South America. And so he was talking to, he was getting ready to talk to some Cub Scouts. And there's this little Cub Scout about this big. And he comes over and says, are you the guy that rode from the Arctic Circle down to the tip of South America? And Dan says, yeah, that's me. And he's thinking, he's going to, oh boy. The little kid says, you are one weird dude. So, this is only an N of 3, but Ansel Keys. So Ansel Keys put together cholesterol. I mean, he died just, I think, 3 months short of his 100th birthday. Jerry Stamler at Northwestern. He was part of this Italian, they all went to POP in the summer and ate vegetables. He died at 102, and then I had an email from Henry Blackburn last night. And he's down in Florida, and he's 98. Just chugging along. And it seems to work. Okay, so the answer is it's easy. Stay active, eat your veggies, don't smoke. Ban electronics from your bedroom. You'll sleep better. Give thanks, be kind, and be well. Well, thank you very much.
Okay, the MC is not here. Okay, I get a job. Okay, so we have a 15-minute break. If you want to stay here, I will have the physical therapist then to lead some stretching exercise. And you can have a break or you can stay here to do the stretching.